All right, welcome. Today we have with us Kelly Wilson. She's the Regional Director of Patient Care Services, as well as we have Jacob Holt, who is a physical therapist with Applegate HomeCare and Hospice. Today, the purpose of our video is to go more in depth into the importance of physical therapy in home health. Thanks for being with us, guys.
Thank you.
Sweet. So let's just get right into it. First question is actually for Kelly. Why is it important to have home health set up before your procedure?
I think the importance of getting home health set up before a procedure, we look a lot at, for instance, total joints. And I think that getting home health set up is good in the sense that you're preparing for your surgery, you're getting everything prepared. And I think just going into surgery, knowing you're going to have home health and what all that entails is super important, especially for our senior population, knowing that they're going to have that help in the home between nursing, physical therapy, and oftentimes a CNA. Just helps the patient go into their surgery with ease, and they're explained, what each role is, and it's really been very beneficial.
Perfect. Thanks, Kelly. And then this next question is for Jacob. What is the benefit of home health physical therapy versus going straight to outpatient therapy?
Typically, the patient is getting a nerve block and is under significant amounts of pain meds the first 48 hours. You're not in the mood to really leave the home, walk 200 feet into the building, sit for an hour-long eval, and really get out of your house. It's a difficult time, and for us to bring physical therapy to you, just a more effective, more comfortable option for the patient. For example, a knee replacement, your goal at 2 weeks is 90 to 100 degrees, and I can typically get the patient there in a timely fashion, as opposed to coming into the clinic and dealing with falls potentially happening, adverse events. It's just a better, more comfortable option for the family. Totally. Same thing for a shoulder or hip replacement. There's certain goals that I try to help the patients reach. It's for me to come to your place and do it. It makes it just a lot easier for the patient.
Yeah, for sure. And then with that in mind, what is the benefit of doing outpatient therapy?
That's a loaded question. So we'll take a knee replacement, for example. I can typically get the patient 90 to 100 degrees by 2-ish weeks. Your goal for the end of that is close to 130 degrees of knee motion. Typically hard to get that motion in the home alone. There's some studies that are out there showing the pros and cons of unsupervised therapy versus supervised therapy. And the benefits are strongly in favor of supervised therapy, having a clinician with the patient coaching them through. The benefit of outpatient is I have equipment. I have a total gym. I have a Genu Ease, which is not seen in every clinic, to help you get your motion. So I can be a little more tailored with your care. For a knee replacement, I keep bringing that up because it's a more time-sensitive surgery. You have 6 weeks before scar tissue sets in. My goal is to get you in home care, out of home care in 2 weeks, into outpatient, so that by when you see your doctor at 6 weeks follow-up, you're not looking at a manipulation or anything like that. I can take care of you and streamline that plan of care. Same thing for the shoulder and the hip. Most doctors don't recommend outpatient for shoulder or hip replacement. Some do, but same kind of ideas. I have access to equipment, and I can kind of better tailor your care after the first initial 2-week period.
Totally. And I think you honestly already answered this one. Why would you transition to outpatient? It really sounds like just having that different equipment and stuff like that.
Yeah, it's really different equipment, right? So unfortunately, I don't have the luxury to bring all my bands, weights, a Genu Ease, which is a $10,000 piece of equipment, to your house. I can typically do well the first couple weeks, but if your goal is to optimize your function and outcome, you're going to want to take it to the next level and go to outpatient therapy.
Totally. Well, sweet. Well,
Quite like even working with a therapist, patients are more apt to continue the therapy and be religious with the therapy versus, as you said, unsupervised, and not somebody really encouraging, teaching, and all those things that we've seen when, because a lot of times patients are resistant, they hurt, and they don't want to do it. And so I think somebody really working with them is keeping them on track to prevent that scar tissue from building around the new joint, which leads to a manipulation, which is not fun. So
yeah, Kelly, I'll leave the floor open to you. If you have any other questions for Jacob, you guys can kind of talk through those.
And I think Jacob and I have talked about too, I think the importance of beginning with home health in the home is also we have a nurse involved. And so the nurse is coming in and doing the admission and really there to just make sure that the patient is rehabbing medically the way that we all anticipate they will, coming out of surgery and stuff like that, making sure that everything's moving the way it's supposed to. And that, if there's questions or concerns, they have a nurse in place, which is a lot easier to get a hold of and get questions answered in a timely manner. You got to realize that the surgeons are in clinic with patients or they're in surgery. So getting a hold of their nurse, and if it's something the nurse feels she needs to get a hold of the surgeon, she can. And I think a much faster process than the patients leaving a message and waiting till end of day when they check their messages. And so it gives that patient that comfort and, knowing that they have a nurse that they can check on them if they feel like it's necessary. So
just to piggyback off that a little bit, it's truly a blessing to have a nurse. I'm typically seeing the patient more frequently than the nurse does as a physical therapist. I'm seeing the ins and outs of their pain. I'm seeing what problems that could arise if they haven't had a bowel movement in 7 days. I'm calling the nurse to quarterback that to help me treat that patient to make sure that they're doing well. If their blood INR is too high or too low, I'm coordinating with the nurse. As opposed to coming to outpatient therapy early on in the acute period, it's now you're coming to outpatient therapy, you're driving to the hospital, as opposed to us coming to your house and taking care of that for you. It's a pretty optimized plan of care with home health.
Okay, that's awesome. Sweet, thanks guys. Any other comments?
I think it's important to note that home health is 100% covered by Medicare and most all insurances. And so, there's no out of pocket expense for the patient. With some insurances, you may have a copay, but I think it's worth it when you have a team that's watching over you after surgery and making sure that you rehab in a good manner, as we all expect you will, and have that support.
Yeah, no, I totally agree. Well, sweet. Thanks, guys. Thanks for being with us today.
Thank you.
Thank you.